Hello, my name is Eli W. Martin. This is the BSN Capstone Evidence-Based Project presentation. The clinical setting that I was at was Select Specialty Hospital in Camp Hill, Pennsylvania. This is a critical illness recovery hospital, one of the 3 locations that are in that general area. I followed the wound care specialist. This was my area of focus, and my preceptor was Demetra Curley. She is a bachelor prepared nurse, as well as has her continence, wound, and ostomy certification. She is widely regarded both within the company and outside the company as an expert in her field, and has gained the respect of nurses and physicians alike. I had 3 areas of learning goals. One was to perform a negative pressure wound therapy dressing change, also simply known as a wound vac, and identify wounds that are appropriate for negative pressure therapy. The second area of goals that I had was to identify areas of knowledge deficit within the staff, nursing and nursing assistants, related to skin breakdown and pressure injury development and treatment. And then my third goal was to develop a plan to educate the staff on pressure injury prevention, and using my previous goal of identifying areas of knowledge deficit and focusing on that. In accomplishing these learning goals, for the goal 1, I worked closely with my preceptor, and I was able to identify multiple wounds that were appropriate for wound vac therapy. And we also spent some time discussing contraindications for this type of therapy. These are wide-ranging, but they include things like a wound that's hemorrhaging too much, cancer in the area, or a high level of, or a lot of necrotic tissue that's overburdening the wound. Those are some of the contraindications. I also performed a wound vac dressing change on a patient that had a sizable pressure injury in the sacral region. To accomplish my second learning goal, of identifying key areas of knowledge deficit, I worked alongside staff, and I was able to observe current practices. I focused on current practices rather than written protocol because it allowed me to see what was actually happening on the floor. Experience has taught me that having a protocol is one thing, but it's not always the reality on the floor, and I wanted to see what was actually happening. I found a general lack of understanding on the full functionality of the specialty mattresses that are used, and they're used primarily to prevent skin breakdown, and a big part of that being pressure injury prevention. The mattresses are the low air loss alternating pressure mattresses. So in addition to these this knowledge deficit, I found 2 areas of inappropriate practice focusing on what was actually happening. I found that there was frequently excess material between the patient and the mattress. This prevents the functionality, the full functionality of the mattress. And I also found some incorrect settings on the pump of the low air loss alternating pressure mattress. To accomplish my third goal, I educated the staff generally on the topic, and then also specifically highlighting the key areas of deficits that I found. Part of the way I did this, I interviewed 6 staff. 5 out of the 6 were unaware of the low air loss functionality of the mattress, and 5 out of the 6 were unaware of the hammock effect that can happen, which prevents the alternating pressure from functioning appropriately. The staff, these 6 staff, 3 of them were nursing assistants and 3 of them were nurses. So I took a 50-50 sample between nurses and their assistants. I addressed this by producing some educational posters. I produced 2 of them that were posted together. The first of the 2 was a general poster explaining what the functionality is of the mattress, why we use them, kind of how they work. And then the second poster was best practices, and I highlighted areas of knowledge deficit that I had identified, both in my interviewing and areas of knowledge deficits or areas that were indicative of knowledge deficits based on inappropriate practices that I saw on the floor. I also provided face-to-face education for 6 of the staff members. I posted these posters 2 different places, on a corkboard in the main area, where right in the area where a huddle is done every shift, as well as in the lunchroom. Here's an example of the poster that I made. This is the first of the 2. This is more of the general what and why, preventing pressure injuries through the proper use of low air loss alternating pressure mattresses. And I highlight what they are, why we use them, and how they work. Here I highlight the fact that they have 2 functions. One is the low air loss, which helps prevent moisture buildup and kind of floats the patient on the surface of the mattress. And then the second main functionality is the alternating pressure. The second of the 2 posters here that I have is best practices, do's and don'ts. So this poster highlighting best practices, I have it broken into 2 categories, ensuring that there's appropriate settings. And I have a photo here at the bottom of the poster highlighting which setting the mattress should be on. And then I also highlighted the areas of inappropriate practices that I had noticed on the floor, how much material should be left in between the patient and the mattress, namely 1 sheet and 1 absorbent pad, and also which I have represented in a picture here in the lower right. And then I also have a little visual here of the hammock effect that can happen, as well as explained it here in the poster, how having too many layers between the patient and the mattress can minimize the benefit of the alternating pressure. Reviewing the literature, this is a small example of a large amount of literature that's available on this topic. These would be more recent studies or journal articles. 2 of these look into the usage of negative pressure wound therapy. Negative pressure wound therapy is not new. It's roughly 30 years old. But these 2 resources indicate that it's still very helpful, it's still useful, and it can be used in a wide range of conditions, wide range of different types of wounds can benefit greatly by using this therapy. And I also have referenced here to some literature that looks at using alternating pressure mattresses or mattress surfaces to prevent pressure ulcers, and that shows that it is beneficial in preventing pressure injuries, certainly compared to a regular foam mattress. The current best practices, comparing this with the clinical site I was at, for the most part, aside from the areas that I referenced here earlier in this presentation that required additional staff education, the site for the most part followed the evidence pretty well. Their practices were consistent to a large extent with the current literature. There's a couple areas specifically that I noticed in which their practice was clearly consistent. There was a widespread use of negative pressure wound therapy which is certainly consistent with the literature. They use that type of therapy on a wide range of wounds, and this can be very helpful and is certainly far better compared to, say, just a basic moist to moist or wet to dry type of dressing. There was a widespread use of the low air loss alternating pressure mattresses. That's consistent with the literature. A big part of plays a big part in preventing wound development, as well as preventing wounds from getting worse. There was the expectation at the clinical site to reposition the patients, in spite of being on these specialty mattresses, to still reposition them frequently. This is consistent with literature. There was a heavy focus within wound care to maintain peri-wound skin integrity. This was done in a couple different ways, providing a skin barrier on that healthy skin in the peri-wound region, making sure that the foam of the wound dressing wasn't lying on top of good, viable skin. This is certainly consistent with literature. And finally, the mattress settings and the proper use was, aside from what I mentioned earlier, was for the most part consistent with the literature or with the manufacturer's instructions. They were using the mattresses appropriately, aside from those areas that I identified. Reflecting on the personal effect of this clinical time, it allowed continued exposure to a specialty that I am interested in and that I see myself pursuing in the future. So it allowed for continued exposure to that, gathering more information, receiving more education personally. This fulfilled the requirements for my BSN, which certainly could play a part in potentially landing a job in this field, and certainly could play a part in having more job opportunities. I gained experience in producing educational material in the posters that I produced, as well as I gained experience in providing direct one-to-one in-person education, in addition to the more general poster production and posting. Thank you. Again, my name is Eli W. Martin, and this is the Nursing Clinical Practice Capstone Evidence-based project.